My name is Mora McLaughlin. I am a construction communications project manager at the Pittsburgh Water and Sewer Authority in Pittsburgh, PA. I basically work with residents, community groups, elected officials, really anyone that will listen about the water and sewer investments that we're doing here in Pittsburgh. So I oversee all of the outreach on our water and sewer projects, which also includes our lead remediation program, which we call the community-led response. I guess it all began when PWSA's water exceeded the EPA action level for lead in 2016. So that meant that we had to start aggressively replacing our lead service lines, as well as optimizing our corrosion control treatment to reduce lead levels across the board. The primary goal was just to regain the public's trust in our water. And there was really no shortcut for this. So we were holding community meetings every week, sometimes multiple in a week, just getting out and listening to the community's concerns and making people more aware of what we were trying to do and the programs that we were trying to develop to turn the lead issue around. While we can't replace all of our lead lines at once, which is, a service we offer, we do offer lead service line replacements at no cost. We knew we couldn't do it all at once, right? It would take many years. This program started in 2016 and we're still replacing lead lines now. So we needed to direct our efforts to the most at-risk populations first. That was a main priority of ours. One thing to know about lead is that some of our most vulnerable populations are at highest risk, right? So small children and pregnant women are at a very high risk of ingesting lead or for ingesting lead. Whenever we set out to start a project that's going to impact service lines at all, we always look at several factors to prioritize that work and make sure we're investing in the most vulnerable communities. So we look at the prevalence of children and women of a childbearing age in an area. We use census data for that. We look at blood lead levels in children that we receive that data from community partners. We look at income levels in communities. And of course, we look at the prevalence of lead service lines in that area based on our historical records. So all of these data points come together to provide us a better idea of where we should invest our money. And, the work that I do with the community-led response, it impacts my friends, my coworkers, my neighbors, basically anybody who drinks our water. And that's something I'm really proud of. I like to know that I'm, doing my small part to rectify this issue that's been with us for a long time.